Hey yo, what's with Achieve? Welcome to yet another video. And today I wanted to talk about the health risk that toxic and stressful or overly strenuous work environments, specifically nursing, what it causes. Okay, what are what is the impact on our health? Okay, or the health of the people that continue in such occupations. Okay, please, if you're new to my channel, go ahead and like this video, share, leave your comments. And I want to talk about this, okay? I was reading about this in a health publication, and well, actually, it was actually nothing that I already didn't know. But sometimes it's just good to kind of like read up on things to kind of like get a like more like a better understanding of what it is that you already know. So if you don't know my journey, I became a registered nurse in 2010. I worked as a nurse for about 10 years. And in 2020, right before the pandemic, I left nursing. Okay. I went into doing things, basically working for myself and being entrepreneurship. Okay. And one thing that I will always say is that leaving nursing literally saved my life. Okay. And this is not a, to talk down on anybody that maybe they enjoy nursing or, maybe that is their calling. But I would like to say, or I would have to say that overall, the impact of the work environment is very, very detrimental to your health, your mental health, your physical health, your relationships, and your life overall. Okay, please, if you're new to my channel, go ahead and subscribe to the channel, like this video, share it, leave your comments, and let's talk about this, guys. Okay. When I was working as a registered nurse, well, first and foremost, I worked in several different facilities, and a lot of times I would be very, very overwhelmed, especially in the skilled care facilities, but I know it's no different in hospitals. Just the workload, the unfavorable work conditions, a lot of the, like, how do I say this? The cattiness that would go on. It was very shocking for me, especially coming in as a new grad nurse. I didn't know that I would be thrown into something like that. It was something that was, because it's like when you're studying, a lot of times I would do group study like with my classmates and things like that and everything. And it was like, nobody prepared me for what it was that I would actually deal with. Okay. It was something that, like, nobody can prepare you for. Okay. So I would say that within 6 months of actually becoming a nurse, I was very, very overwhelmed, and I was very, very, very frustrated. It was as if my whole life was over. Okay. So, and like I said, my mental health was going down, and my physical health was also declining. So I'm going to go into this article. Like I said, I think it's like PMB, the name. But anyway, it said here that today most nurses work extremely strenuously. Okay. And due to the unfavorable workplace situations and exposures to workplace hazards, they become more vulnerable to diseases. Okay. So they are more prone to contracting diseases. One common disease that nurses are not spared is having cancer. Okay. Now, we know that cancer or stress, especially intense stress that you face when you are in nursing, okay, the unimaginable stress that you face on a moment by moment basis when you're in nursing, it gives you a higher incidence of cancer. Okay, the video that I did talking about from registered nurse to delivery driver, and why I would never go back. And by the way, since So delivery, I use delivery driving as a foundation to kind of like get stable. After leaving nursing, I needed some income. Okay, so I went back to doing hair and I was doing delivery. Okay, and I've added several different things. So actually, I have the multiple streams masterclass bundle, teaching you how I was actually able to transition from nursing and to be able to survive and thrive afterward as an entrepreneur, doing digital marketing successfully, um, running a middleman business. I have a middleman cleaning business, a mobile business, and yeah. So all my business, all the businesses that I'm able to run successfully, and how I'm still able to do it with 3 teenagers. Okay, and thereafter leaving a narcissistically abusive situation, and being able to thrive as a single parent. Okay, and as an entrepreneur. Okay, so doing delivery, working as a mobile entrepreneur. So running initially the hair business and then a mobile notary business, then also working as a middleman, running a cleaning business, and then also doing social media. Obviously you can see that I promote my digital products on YouTube, but yes, it says often referred to as the big C. Okay, so let's talk about cancer. This dreaded and life-threatening disease knows no boundaries. Okay, so it affects all ages, races, colors, ethnicities, etc. Okay, so this article is actually tying in the stresses and the stressors or the strain that nurses, and I would add, I would add, well, this is talking about nurses, but I would add, like, if you're in a toxic work situation, whereby you're actually having panic attacks when you think about work, I would advise you to think about your health, okay? Because when you are exposed for a long period to such horrible, and unimaginable workplace situation whereby your health is declining, guess what? There's no amount of money, okay? There's no amount of money that you can be paid, because if you're staying for the money, there's no amount of money that you can be paid that can bring back your health, okay? Is there any amount of money, because they say health is wealth, so is there any amount of money that you can be paid that can buy back your health, your sanity, your mental health? Okay, so we're not just talking about, like, physical health. What about your mental health? What about the stress or the overpowering, overwhelming stress that will end up taking away your memory? Guys, I told you I worked in many places, okay? And one of the places I worked was in a psych facility, okay? And from what I saw, a lot of the patients that were now committed, to the psych facilities were ex-nurses, okay? So there is also, there's a link between, and I strongly believe that there's a link between the stress, that, because we're all human beings, okay? It says here in the article, I am a nurse, and I too am walking in the shoes of patient, along with thousands of nurses and other healthcare professionals whose lives were disrupted, shattered, or lost because of cancer. Okay? Shattered and disrupted. Okay? So if you are finding yourself in nursing especially, or just in any toxic workplace situation, understand, okay, that your life is at risk. You're putting your life at risk for the money. Now, I'm telling you that there are other ways to make money whereby you don't have to trade time. And secondly, you don't have to deal with such awful, life-shattering situations. Okay? When I was thinking about leaving nursing, family members, people around me were saying, people will die to be in such in your situation, okay? Because they didn't want to understand the fact that I was going through so much, okay? They didn't want to understand the fact that I was not happy in the profession that I chose. They didn't want to understand, or they, I guess, refused to understand that I was literally dying inside, okay? Until I decided that, you know what, my life, okay, my health, my sanity was worth more than whatever that they were paying, or the status of nurse, okay? And I'm putting out this video to just, to raise awareness, okay, that when you are going through intense amounts of stress that never stops, okay? When I would step into the facilities that I was in, it would be like a punch in the face, okay? Overwhelming stress, all right? And even on my off days, I could not decompress. I could not relax, okay? I tried nights, I tried 3-11 shift. Nothing worked. Nothing worked, guys. Okay, so I want you to think about this. All right. Today I'm working as an independent contractor. I couldn't be happier. Okay, my life is fuller. I can spend more time with my children. I can think clearly. Okay, because if your mind is not freed, guys, there's no way that you can make money. There's no way that you can add other sources of income, because you need peace of mind. Okay? Because with peace of mind comes stability. When you're so stressed out and overwhelmed and panicking and all those different things, it's very hard for you to be a present parent or a wife. Or for in some cases a husband, right? It's very hard for you to be present in the moment when you are facing such overwhelming amounts of stress, okay? All right? So I just want you to understand that just because you're a nurse does not exempt you from the effects, of not dealing with the stressors, or the situation, not deciding to say, you know what, enough is enough. I deserve better. I deserve a change, or doing something to help yourself. Okay. Just because you're a nurse, because I have to say nurse because, a lot of people have that in mind that, oh, you're a nurse, you're a superhero, you can handle it. No, in many cases you cannot handle it. Okay. Like I was saying, my other video, that I did about 3 weeks ago, that went viral, people were leaving comments, nurses were leaving comments, talking about the fact that one said that, I think she was dealing with, I forget what kind of cancer that she was dealing with, but she was still dealing with that, trying to get healing from that, and I had several of them, that mentioned the fact that they had various kinds of cancer, as a result, and I strongly believe it was tied into, just like the article was saying, the stresses that they faced. One said that she's having hormonal imbalance as a result of having to work nights, overtime, and other health-related issues, okay? All I'm saying here is that we have to be careful and we have to take care of ourselves, okay? Because we only have one life, okay? We only have one life. If you're managing other people, but you neglect yourself, that is, it's like self-abuse. Like you are not even seeing yourself as somebody that is worth it, and I'm here to tell you, you are worth it, okay? If there's a chance, and sometimes you might have to take a step of faith, and do something that people around you might see as stupid or dumb, but at the end of the day, it's to save yourself, okay? So if you're someone that is looking at, okay, How am I going to make money apart from a 9 to 5? How am I going to make money if I leave nursing? What am I going to do? Because a lot of times you're locked in that box, like that you cannot make it apart from. There's people that told me that they left for hospitality, that they left for entrepreneurship, they left for truck driving, they left for other things. Even Lyft, driving Lyft. Okay, so what I'm saying here is that there is a way. If there's a will, there's a way. Okay. I have the multiple streams masterclass bundle. If you're looking for a way, or you need a way, it's very affordable. Okay, less than $50, $49.99. Okay, I have the multiple streams masterclass bundle teaching you how to thrive apart from a 9 to 5. Okay, it has the delivery part as working as an independent contractor has 72 different apps that you can get started with. Okay, apply for as many as possible and get started. Okay. Then it has the middleman business guide teaching you how to run a service related business as a middleman. Okay, so you contract with customers, and then you subcontract it with people that are already doing what it is that the customers want. Okay, people need services. Customers will always need services, and people will always provide the services. Okay, if you look all around you, there are cleaning businesses, there are power washing businesses, there are window cleaners, there are lawn services, there are services all over. If you drive around, you're gonna see people's cars. Look at their windows, look on their cars. They have different signs, phone number that you can call. The other day I was at Home Depot, right? Doing a delivery, and I saw somebody that had left a card talking about they do remodeling. Okay, I picked it up, I put it to my stash. Okay, that's another potential business owner that I can reach out to and network with, right, to get customers, right? Because when I get the customers, I don't do the work. I get my cut, right? I book, get the information, and I dispatch, and I keep my money. Okay, so that's another way that you can make money. Another way is digital marketing. Okay, learning how to, guys, if you know how to market a digital product, whether it's a PDF, ebook, if you can market it effectively on social media, you will never go broke. Okay, there's so many people that are looking for the information that you have to offer. Now, within the multiple streams masterclass bundle, the digital marketing part, which is actually the passive riches bundle, it is completely customizable. You can customize it, rebrand it, change the colors, change the pictures, and you can resell it for 100% profit, guys. Or you can put whatever amount, resell it for whatever amount that you choose, guys. But it's available. Okay, there's ways to break out of any toxic situation that you're currently in, especially regarding workplace. Okay, you don't have to be stuck. Okay, I did a video this morning talking about how you can making money, trading time for money is not the only way that you can make money. Okay, even though that's the way we've been programmed by society, but that is not the only way we can make money. We can make money in so many other assorted ways, guys. Okay, just expand your mind. Okay, I'm gonna leave the link to the multiple streams masterclass bundle in the description. Okay, you can get started, grab it. Okay, so that you can help yourself. Okay, nobody's coming to save you, guys. Okay, you have to save yourself. Okay, I'm gonna end it here. I hope I've imparted some knowledge in you, and make sure you like, subscribe, leave your comments, and yeah, till next time, God bless. Peace.